Hello, I'm Dr. David Greene, CEO of the U.S. Pain Network, where we connect those in pain with pain management providers and clinics around the country. Today the topic is a very exciting one, platelet rich plasma, otherwise known as PRP therapy for short. This is a new study that came out looking at PRP therapy for epicondylitis. Okay, that's a long word. Basically what it means is tendinitis around the elbow. On the inside, it's medial, called golfer's elbow. On the outside, it's tennis elbow. Okay, most people know the layman's terms. Well, what's happening in tennis or golfer's elbow? Well, essentially there are muscles that attach onto both of those areas of bone, and initially they get inflamed. It's called tendinitis. Okay, so as the months go by, the inflammation resolves a little bit, but the tendon can degenerate and it goes into what's called tendinosis. So the pain can continue, okay, and it can be a real problem. I mean, patients can be affected for 1 to 2 years, and then maybe it'll burn out on its own. Less than 10% of patients actually end up needing surgery for the condition, but here's the problem, is that this study, which was out of an orthopedic group in southern Florida, looked at over 30 patients, and some had tendinitis or tendinosis on the inside with pain, and some had it on the outside. And it was men and women, but all of them had failed at least 6 months of conservative treatment. They weren't able to participate in the sports that they liked, the housekeeping, the gardening, whatever it was that they liked to do, they couldn't do it. All right? The only option that these patients had was something like PRP or surgery. They had tried steroid injections, they had tried anti-inflammatories, they had tried physical therapy. Okay? What other options really are there to help get rid of the problem? Well, the problem is that once the inflammation goes away and it just turns into tendon degeneration, anti-inflammatories are not going to have the dramatic effect they would have earlier in the course of treatment. So PRP was used. What is PRP? It's your own blood. Okay, so they take your blood out just like a blood draw, they put it into test tubes and then spin it in a machine very fast, and that's called a centrifuge. It spins for about 6 minutes, and that separates the blood into 3 layers. The top layer is what you want. That's called platelet rich plasma, and that has platelets in it, go figure. It also has a lot of growth factors in it which can help with healing. Okay? The other thing that PRP does is when you inject it into the body, it acts as an attractant for your own stem cells. All right? It doesn't have stem cells in the whole blood very much, just a few, but it really pulls them in. Okay? And that's been shown in studies on cows where they injected it into knees and they saw that it helped regenerate cartilage and it helped pull in stem cells. Okay? Getting back to this study, they looked at pain levels, functional activity, and all of it got better with the injections for epicondylitis. So it really did help. Only 2 of the patients out of the 30-some ended up going on to need surgery. And those were high-level athletes who after a month said, this isn't helping me enough, I'm going to go opt for surgery. All right? The others, nobody ended up going on to need surgery. By and large, they were able to get back doing the things that they wanted to do, and the pain level dropped. They only did 1 injection of 3 cc's into the problem area. Okay? So think about that. If pain relief were to work for, say, 6 months or whatnot, and the pain came back, you could have another one, and it really does. It sparks up inflammation and then starts the healing process. So it works, and it worked very well in this study. If you are having significant epicondylitis, then PRP may be for you. Okay? It's not covered by insurance, but it doesn't cost $5,000 to $10,000. We're talking about usually $600 to $800. Depending on the clinic that you go to. Okay? It's your blood, so the risks are very low, and it's an outpatient procedure. Okay? You can have it once and see how well it does, and then if it's working but not good enough, then it may be that you need to have it again. All right, check out our website, uspainnetwork.com. It's very easy to look up those clinics that are closest to you. It's geo-targeted. Just put in your zip code or your city and state. If you don't have a clinic that shows up, just request an appointment and we'll help find one. Sometimes we're in talks with various clinics around the country and may be able to help you. I'm Dr. David Greene, CEO of the U.S. Pain Network. Your pain stops here.